questions on conditions treated or acute, chronic? So the things we'll treat in this class are kind of acute self-limiting things: colds, flus, strains, sprains, musculoskeletal pains, aches and pains, sore throat, cough, burns, things like that. Other things that I treat in my practice are anxiety, depression, chronic pain, severe pain, acute infections, allergies, asthma, developmental problems in kids, fertility, all the kinds of symptoms that women have going through the different stages of life in pregnancy, in menopause, in problems with the menstrual cycle, with pain and PMS and those kinds of things, digestive problems, inflammatory problems, even things like MS and more advanced neurologic, advancing progressive diseases can be treated, especially when we get them early on. The sooner we can start to treat them, the better the result is. So, I'm going to go through and just kind of explain what all these handouts are, so you guys can know. So and anyone watching on YouTube, if you want to just send me an email, you can go to the website, progressivechiropractic.com, send me an email through there, and I can email you most of this stuff, so you can follow along, online. So the brief introduction to homeopathy, that is right on our website, on the homeopathy page. Explains what homeopathy is and how it works. This outline is an outline that you can use to follow and go along with the first 5 classes that we already did last year. So when I talk about in the videos, point 1A or whatever, you'll know where I am on this. This one that's on my letterhead that says cases. These are 3 cases that I'd like you guys to try to solve for next class, and we'll go through and talk about them next class. They are just a little hint. I'm not going to. They may or may not be remedies we talked about in the very last class 5. So if you want to attempt this, I would say go through class 5 and definitely have 1 or 2 of these books around. Well, I'll just tell you, 2 of them we covered to some degree, and 1 of them we didn't. And that's all I'm going to say on that. The next bit of information on my letterhead here is information about nutrition. So I actually do talk about here vitamin supplements, a multiple vitamin that I recommend, vitamin D and the importance of getting tested, your vitamin D levels tested. And then on the second page, we talk about natural treatment and prevention of colds and flus. And I would strongly recommend, as a couple people here tonight kind of indicated, as an alternative to, or even in addition to, if you are a firm believer in getting the flu shot, I don't make it a point to tell people what to do. Personally, I disagree with it for myself. I'm concerned about the side effects and the toxins and neurotoxins that are in vaccinations. But you can learn more about that. Again, we talked about that last year in class 2. But whether you do the flu vaccine or not, the homeopathic remedy influenzatum does a really good job at preventing, boosting the immune system, which should help to prevent cold and flus during the cold and flu season. So that very first point, homeopathic remedies, there's actually several other remedies, depending on how many remedies you feel like taking and how severe your colds and flus tend to be. You could consider taking just influenzatum, or you could add a couple other remedies to the arsenal and protect your immune system. And then there's other information about treatment. If you get a cold or flu, I think the best treatment is homeopathy, but there's also vitamins and herbs that tend to do a fairly good job at shortening the duration and intensity of the symptoms. If anyone's interested, when we're done tonight and you want to go back to the office, I have some of these remedies available for the cold and flu treatment and prevention, so you could start, because we are getting into the cold and flu season, so this would be a good time to start doing that, like this month. The next handout here says fever. And this is the topic that we went over in class 5. We didn't finish this, so we'll be using this handout next class, in class 7. And I'm going through some information about colds and flus and fevers, and also the remedies that we use, the common remedies that we use to treat those, and giving you some information about those remedies. So I will, when I give you information about a remedy, it's not designed to be all-inclusive. There have been, to fully study and appreciate one homeopathic remedy oftentimes would require hundreds of pages of reading. But I'll try to break it down and give you just a few key points, and the books also give you, a few pages on a remedy so that you can understand. If you see the really classic signs of a remedy being indicated, hopefully you won't miss it. Then there's a handout on case taking and a symptom checklist. So it kind of guides you through how to take a case, what kinds of questions to ask, what kinds of symptoms to ask about or to look for, and then prescribing. Just some notes on things like when to prescribe, when not to prescribe, when to call your doctor, those kinds of things. The next chart says dosage chart, and this basically gives you an idea of, this is an attempt to kind of make it a little easier. What I don't like about it is that it kind of removes the individualization aspect out of homeopathy, but it's good because it gives you a general guideline for when you guys are using remedies in fairly low potencies, lower than I would use as a more experienced homeopath, but it gives you a general idea of how often you should be administering a remedy depending on the severity or intensity of the symptom. Okay. So individualization is always ideal, and we'll talk more about that, but this gives you a good place to start.